Hi everyone, thank you for coming today. So overnight or in the last 24 hours we've had 8 cases notified to Murrumbidgee and most of those have been in the Albury and Gindra regions. So we've had 6 cases in Albury and 1 in Greater Hume, and so again it's probably expecting some more cases to come out of this exposure event. So out of that, there has been a number of venues of concern identified. So those people were infectious in the community, or some of them were, and so those venues have been popped on our webpage, but largely around exposures around the 10th of October and the 11th of October. So please encourage you to have a look at the Murrumbidgee webpage or the New South Wales Health webpage, which identifies the sites, and the media departments have those sites too if you wish to release those in the media. We have testing available. There's been additional testing set up in Gindra, and today we also have testing at the Jerilderie Multipurpose Centre and Lake Jellicoe Hospital as well. Lake Jellicoe had a sewage detection yesterday as well, so that community is being able to be tested for in addition to its normal testing availabilities. I think that's kind of it. Does anyone have any questions that you wanted to ask?
Can you just run through the new 6 cases, I guess the links to the previous case, or the household contacts, or the known sources? Yeah,
sure. So look, a lot of the links are still being trying to be identified. We've got a number of people being tested at the moment, and whether they come back positive or negative will give us some indication of the links of those people. So it's a long process to actually identify where all the cases may have come from. At the moment, we don't know where our initial source or the initial source of infection has come from. So it'll be an ongoing investigation to try and determine that. Hopefully, someone that turns positive will fit the puzzle together for us. But at the moment, we're still investigating that. We don't know that all the cases in our region, in the Albury and Gindra cases, are linked at this point. We haven't managed to connect them all just yet, but as I said, investigations are ongoing into that.
How many of the new cases were linked to the Z-Bar case?
Look, at the moment we've got 2 cases that have been to the Z-Bar that we're aware of that were there at the time that the infectious case was there at the time. So there may be other links, but at the moment we've only got the 2 links.
So the new ones from today, the 6 from today, are all from a different location or source?
So one of them from today's data was I think late yesterday, one that was linked to the Z-Bar, and yes, the other ones we haven't been able to establish their links for an exposure site at this point.
A number of exposure sites have obviously popped up now, assuming that these cases were infectious in the community for some period?
Yes, so those exposure sites do indicate that they're venues that we know that people who are infectious have been to. So we're encouraging anyone who's been to those venues to get tested and stay home until you get your result back. So for anyone who has been to that Z-Bar or any of those other shops that we've listed on the site, the guidance for you is to stay home until you get your test results. So don't go to school, don't go to the shops, don't do anything until you know that you're negative, because somewhere there's a risk of exposure there and we just don't want it spreading further.
And you're expecting that list of exposure sites to grow?
Look, as we get more cases, of course, the risks of exposure sites will grow. Currently, we've interviewed the cases that we've got, and they've told us where they've been to date. But sometimes, of course, people remember things that they'd forgotten. So, it's always a possibility we'll have more sites added to that list when people remember they might have gone somewhere that they forgot to tell us about, and they remember a day later or 2 days later, and they let us know.
And
Were any of these 8 new cases reported yesterday?
We did mention that as a couple of those cases were under investigation and missed a cut-off from yesterday, so they were included in today's data.
How many active cases have we got in Albury specifically at the moment?
Well, that's a good question. So I think there's Albury and Ginger, if you include both of those. So I'm just doing the maths. I'm sorry, I don't have the exact number, but I think it would be about 10 or 11.
And can you just walk through Ginger? So I think we had reports that one of them was a student at a school, a young person.
Look, there has been an exposure at a school, and the Department of Education and is, as per New South Wales protocols, they are working with the schools to identify children who may have been at risk for that exposure.
Do you know what the advice is around that school? Is it closed and then all students and families are told to test, or what's the advice around
The general advice, and I haven't specifically spoken to the principal about the identified risks. Schools do the risk assessment based on where they know that child had been in what class. So the general is that anyone who is in a class with that child will be a close contact, and anyone else at the school is generally casual. If they had, depending on their activities, whether there was crossover or not, and I'm sorry, I haven't had a feedback of whether that has been determined or not.
And just with testing, the Lavington site was closed this morning. Will that be reopening, or what's the go with that?
Look, I'm sorry, I don't have that information there with me at hand. Today's Friday, so look, I don't know. I know that we have made approaches for the drive-through at the showgrounds to be open and extend its hours, and I know that the Wodonga testing has also got set up for people to come through as well, in addition to the additional testing site that Murrumbidgee set up in Ginger.
What's the demand like for testing today, given that or I guess the last couple of days, given that we do have these numbers?
Yeah, the demand is really high. Everyone's getting tested, which is fantastic, and so we encourage everyone to continue to do that. If you haven't been able to get into a testing clinic, please still isolate until you can get into a testing clinic. Please don't, as I said, we need everyone to isolate until they know they're negative.
Just in terms of the investigations of acquisition, so none of these cases have been to Melbourne or Sydney or been in contact with people who have?
Well, to my understanding, none of those people have travelled to Melbourne or Sydney, but in terms of whether they've been in contact with someone that has been to those areas is difficult, because obviously they won't know everyone that they've been in contact with. For example, if you're in a business and someone comes in who is a transport driver, for example, from Sydney or Melbourne, you may not know that and been exposed to them. We haven't been able to identify an obvious source of infection to this point.
I'm not sure if you're aware, but we'd heard that there was a fake text message being sent out to people saying that they were COVID positive in the local area. Are you aware of that? And I guess what's your message to people who are doing stuff like that?
Yeah, look, I am aware of that, and it's quite unfortunate. Fake messages aren't funny. It does take a lot of our resources to investigate those things. And it does waste a lot of time that we could be putting into productive investigations. It also can have flow-on effects to businesses who may shut down when they think that they may have had a case or an exposure site at their venue based on fraud. And so it is a very wasteful and expensive joke on the community, and it's not funny at all. So please don't think it's funny to text your mates to tell them they're positive. It is not a joke.
Are you investigating the matter, or is it a police thing now? Or
it's in the hands of police.
Just in terms of piecing that puzzle together, is it genomic sequencing? When do we know if these links have clear acquisition from Sydney or Melbourne clusters?
Look, that's a really good question. I will tell you that genomic testing does take many weeks to get done, and they do not do genomic testing on every specimen that's done, and so I'm not sure at what time frame that would get back. So we'd have to request specifically, which we will do, to try and indicate where they may have come from, but it does take time and probably won't impact specifically on our investigations and our response, because it takes too long to come back. We've done the work before the genomic testing results.
So do you expect it's more conversations with people that will reveal exactly where it's come from? Is it, is genomic sequencing important considering we've got no known vaccination?
Yeah, so genomic sequences is important for a range of reasons, including policy making and so forth, when we determine how far and how wide the virus travels, and also patterns. If there's changing, it alerts us to know where there's new strains in particular, and how those links work. What we're more likely to find is through our investigations and our testing of the positive cases here and our contacts. That's where we're more likely to find out where the risk has come from.
Can you give us just a general demographic breakdown? Are these people, all in a similar age bracket?
Look, I don't have them in front of me, but there is a range of age groups that has been infected. So, sorry, I'll have to get back to you with the date and the age range.
What about vaccination status and health? Is their sort of current health? Is there anything you can tell us about?
Yeah, look, I can't also tell you about the vaccination status. I know that it has been asked, but I haven't compiled a report on that. To my understanding, their general health has been okay. There's been, but individually there may be some issues that I haven't been aware of.
All of them are isolating at home, none require isolation at the moment?
Yes, all of them are home isolating, and they've been linked in with the home virtual care team from Albury-Wodonga Health, so that they're being looked after in their homes.
So we've got the earliest exposure for last Friday, and the initial case that we've been made aware of had those exposures. Is the sort of line of investigation you're pursuing that they're likely all linked, or are you thinking at this stage that there's been a couple different ways that the virus has gotten into the community?
Yes, so look, I think that potentially they could be linked, but we haven't found that link yet. So until we know otherwise, we'll have to treat them each individually on their own merit, and keep working with them to try and establish a link. But it is possible there's a couple of exposures out of that, and they've come from different directions. So, and we're still investigating that. That can take weeks to reveal itself.
Just got a couple of questions from Wagga.
I do too.
Okay. So just wondering how many people are impacted by the case at Barham High School, and how many are close or casual contacts?
Yeah, look, again, I don't have the numbers on that. So Barham High School has been referred to the Department of Education and the Ministry to do the follow-up for close contacts with that. And again, similar to what I mentioned before, anyone in a class with that case would be put as a close contact, and other people, depending on the cohorting and the mixing at the school, may be casual or close, depending on their relationship they had with the case there. So I don't have numbers, I'm afraid, yet.
Do you know what's going on with the Greater Hume case?
The Greater Hume case is a Jindarung we were just referring to. Yeah.
And how are the staff levels tracking at Deniliquin Hospital?
Yeah, look, the staffing at Deniliquin Hospital is fine. As I said yesterday when I was speaking with you, that where staff had to be furloughed or did not work because of their vaccination status, the Murrumbidgee either got in locums or got other health service staff to work there. So we've got a fully functioning hospital there, and it's fine for the public to be reassured that they can seek care and be looked after at the Deniliquin Hospital.
The question from the DA was just about difference in full vaccination rates, and if we know why, Hayes really high, some are quite low, and is Riverina rates contributing to, I guess, that idea from the government to push back regional travel for Sydney-siders?
Look, the vaccination rates do vary from all the local government areas, and there are some that are less good, less impressive than others. I think certainly the government has pushed back in allowing the regionals a little bit longer to get their second dose, because initially we had less access to the vaccine than the metro that Sydney did, and so therefore they have given us to many people to the 1st of November to be double vaxxed for many of the business rules and so forth. So that is the background around it. It's continually being assessed when we see an outbreak in an area where the vaccination rates may be less than ideal. That's taken into factor as to the response that occurs there.
Just going back quickly after looking at notes, so with all those exposures, I think they're anyone who's been there, they're all considered casual contacts, aren't they? How many sort of close contacts from those businesses in terms of staff and family members? How many close contacts have you got?
Look, individually, there's a number of businesses, of course, and for the general public, we've announced that everyone should be a casual contact, and as I said, get tested and isolate till you get your result back. Through individual venue assessment, risk assessments with the staff, the managers, that will depend on the actual exposure that they had to the cases, and we work through those, and we directly contact those individuals rather than a blanket SMS, a blanket media. So those close contacts that are identified are, as I said, individually contacted and provided the advice on isolation and testing. Anyone who is a close contact will need to isolate for 7 days if they're vaccinated and 14 days if they're unvaccinated, which is another good reason to get vaccinated. And there's testing regimes for those people who are close contacts as well, whether they're vaccinated or not. So please, we encourage you to get vaccinated, because even if you're if you're exposed to COVID, the vaccine will allow you to not isolate for the full 14 days. So it's a great advantage to be double vaccinated.
Of those initial close contacts, when are you expecting all those results to be back in?
It takes a number of days for people to get tested and get the results back. We're expecting those results from today and the next few days.
Thank you, Tracey.
All right, thank you.
Justin, do you want to have
Thanks, Tracey. Firstly, just to go over a couple of points there, and firstly thanking Murrumbidgee Local Health and the Public Health Unit for the work that they do, and obviously for our frontline health staff as well. A couple of points there. One thing to be aware of is that venues often get now an automated contact in terms of whether they are a venue of concern. So we are finding messages going out before the health authorities can get the relevant media out. So appreciate that occurs, and thank people for their patience in that regard, and understanding that Murrumbidgee and Albury-Wodonga Health will get their media out as timely as possible, but there can sometimes be obviously comments going out in social media in advance of the official media statement. The second part is to reiterate the close contacts and needing to isolate for 14 days if you are unvaccinated. And as Tracey said, 7 days if you are vaccinated, 14 days if you are unvaccinated. Reiterates another good reason, if you did need another reason to get vaccinated, that is another really important reason. And finally, in that regard, obviously the reasons why the double vaccination to enter businesses is in place. It's bearing out this week with the positive cases here in Albury. It is a challenging time for our businesses, as we spoke about yesterday. Reiterate our call for people to be respectful of businesses and of people, of teams working in businesses. Please get tested if you show any signs. Get tested if you've been to a venue of concern. And importantly, continue that call out of getting vaccinated so that you can enter businesses, so that you can keep yourself, your family and the community safe.
What was your reaction to the news about regional travel for people from Sydney being put off until November?
Obviously, the government has always taken into consideration the need to strike a balance there. We know that there are obviously businesses, particularly tourism, that are heavily impacted. They're looking forward to having visitors from the metropolitan areas, but striking the balance with the need for vaccination rates across regional areas to strengthen. So this is taking the right approach. It's a balanced approach. It is giving a few more weeks for regional areas to make sure we can drive that vaccination rate as high as we can.
Just on some of our local exposure sites, they're obviously quite high traffic areas. What's your level of concern about these exposure sites and the risk to the community?
Yeah, look, obviously there is the risk to the community, particularly if you are unvaccinated. And we need to remember that this is now, an issue in particular for those that are unvaccinated. Can't give enough encouragement to go out there and get vaccinated. Our community's responded really well and continuing to respond really well in that regard. For those who still haven't been vaccinated, make sure you do. The virus is here in your community.
And is there any response to that? I don't know if you heard that text message that was sent out, a fake text message saying that someone was COVID positive. Have you heard about that, and do you have a response to the community in regards to that?
No, not aware of that, but as Tracey spoke about, obviously, this is a challenging time for people in our community. We need people to do the right thing, and obviously the impact that putting false messages out there does have on businesses, other people. Please be considerate. Please take into account the challenging circumstances we are in. There is no need for these false positive messages.
Could a lockdown be looming, or is that something of the past?
The whole reason we've moved into this part of the roadmap is to try and avoid lockdowns. There is no appetite for a lockdown in that regard. Obviously, we need to make sure that we are continuing to be in control in that regard, and the best way to be in control is to follow the public health order, making sure you're vaccinated, making sure that businesses, that we are supporting those businesses that are doing the right thing.
Just on school, so this, if I'm right, would be one of the first sort of exposures or cases related to a school in our region. What's the New South Wales government doing to prepare schools for COVID and to safeguard against it in terms of, maybe air filtration measures like Victoria? What's happening in that space?
Yeah, first comment, I'll just go back to Tracey's comments in terms of with regards to school, childcare, there is a particular branch of health and education that are dealing with providing advice to schools and education centres where there may be a positive case. So again, that is often liaising between that specific branch and the relevant school or education facility. In terms of the question, again, this has been under consideration for several weeks now. The Education Department, in consultation with health, making sure they're examining what are the appropriate steps to make sure that schools are as COVID safe as possible. Thanks all. Thank you.